You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, if this is the first time you're listening to the Veterinary Rehabilitation Podcast, a huge welcome. Thank you so much for taking the time to listen. If you want to get notified every Wednesday when I release my next episode, then please click the subscribe button. To my long-time listeners, thank you so much for your continued support. I appreciate each and every one of you. Now, I'd love to connect with you on Instagram, so please take a screenshot of this podcast, post it on Instagram, tag me at Onlinepethealth, and let's get connected. It's so great hearing from you, knowing that you're all joining me each week and listening to the Veterinary Rehabilitation Podcast. This week here is a big shout out to Hannah Johnson from @Canine Physio and Fitness. Hannah, thank you so much for sharing your story. I'd love to gift you a limited edition veterinary rehabilitation podcast mug. So please, can you email me at megan@onlinepethealth.com and I will send that mug straight over to you. Now, vet rehabbers, if you are looking for some online learning to do, we've just updated the webinars in our free membership. They are Mind-Body Exercise for Dogs, What is the Role of Canine Cognition and Therapeutic Exercise? And that's in the small animal membership. For our equine membership, it's returning the equine athlete to work after injury, and that's with Lee Clark. And then our hydrotherapy membership, it's What's New in Hydrotherapy Research with Arielle Pechette Markley. So this week's podcast is actually with Arielle, and we are chatting about the latest research in hydrotherapy. So it's going to give you a taster of what's in that webinar. So if you enjoy the topic this week, you can learn more by watching the webinar, which is currently in the free membership. Now, we rotate these webinars, so depending on when you're listening to this podcast, you may or may not have access to the recording. If you don't, there will be an equally excellent hydro training available. And if you want access to this webinar, you can always sign up to our hydrotherapy membership, and it will be accessible in our library together with 80 or so other trainings. Now, to sign up to our free, you can go to onlinepethealth.com/free. So over to Arielle. Hey Arielle, thank you so much for joining me.
Thanks for having me.
Arielle, won't you tell the listeners about yourself and how you became interested in hydrotherapy research?
I am currently a sports medicine and rehab practitioner at The Ohio State University Veterinary Medical Center. I'm also completing my sports medicine and rehab residency through ACVSMR. And how I became interested in hydrotherapy research, well, I like research in general. We've had this discussion about how much I like kind of digging into the research. And one of my favorite things is to kind of go down rabbit holes. And I am lucky because I'm at the university, so I have access, to the whole library system of all the research. And the hydrotherapy thing specifically got triggered by kind of a Facebook thread that, somebody made a pretty black and white statement about a contraindication in hydrotherapy. And they were like, oh, well, there's research that proves this. And I was like, that doesn't seem right. And so they couldn't find the papers. And I was like, I'm pretty sure there's nothing out there that actually says that. And so, what do? Like, I dug up all of the hydrotherapy research in existence and read it all. And, note that claim was not actually true, but that's how I got into it. And I was like, well, I've already read it, so I might as well do a lecture on it.
Yeah. So that's how the Online Pet Health members benefited. So from you seeing a Facebook post, you looking into all the research, and then we got an awesome lecture on the updates and all the hydrotherapy research, which was a great lecture. One of the things I loved in the beginning that you mentioned is like sometimes we get into this like habit mode, where we're just doing things in practice and we don't really know, the research behind it. And sometimes, we're so busy practicing that we don't update ourselves. I even had after that lecture that you did, somebody who actually lectures at a university who said to me, wow, there's a whole lot of research there that I wasn't familiar with. So she was so used to just lecturing the same things that she lectured on and quoting the same research that, she had forgotten to keep up to date with all the latest.
Yeah, I mean, I think it's especially hard in our field because, sports medicine and rehab is a newer specialty. The research is still very new. And so there's a lot more that's been coming out in just the last few years as kind of the specialty grows. And it's hard to stay up on it because there's so many little like niche areas of sports medicine and rehab. And, one of the downsides of like the research and the publication in general is the access is not great unless you're at a university. A lot of times the articles, you have to pay for them to view them. And so, yeah, it's definitely not the easiest to stay up on research.
Yeah. And then I think, for a lot of us, because of that, then we just read the abstract, right? And then you just take some information from there, which quite possibly was what happened in that Facebook post. You take the information and you just think, okay, well, this is what this means, without actually reading the whole research article.
Right. And obviously all research has its limitations. And so unless you actually read the article, kind of get an idea of, what was the sample size, how was the research done, how were the statistics done, it's hard to make, hard and fast conclusions just based on the abstract.
For sure. So, all that research that you looked into now, so the latest research, let's like divide it up into maybe swimming and the underwater treadmill. So let's concentrate on the swimming now. Was there anything in the latest research now that you think is really important to us to use in clinical practice?
Yeah, so there were a couple of new articles for swimming. The most recent one was an article by Fisher in the American Journal of Veterinary Research that actually looked at the effects of flotation vests and water flow rate on the kinematics. Now, there were some limitations with it. They had only had 7 dogs and they were all huskies, but it was a pretty well done study. And they did it kind of over a pretty long period of time to adjust the dogs to the swimming. And so I think we can actually make some decent conclusions off of it, that the swimming protocols for, rehabilitation should start with dogs wearing a flotation vest and swimming against kind of the low water flow rate, and then kind of progressing to a higher water flow rate without the flotation vest to get the maximum range of motion for the limbs. And they also found that there was a bigger difference when they increased the water flow rate gradually rather than decreasing it during the session. And that, swimming has the potential to increase the range of motion for the front legs more than the back legs based on kind of those kinematics. And that makes sense. Dogs typically swim with their rear legs tucked under them more for that, smooth flow through the water.
Yeah, and it's quite a controversial topic often. If I think about in the Facebook groups, it's like, flotation device or not, which one should you do? And there's some people that are like completely against them. And then the other people that like to use them sometimes and other times not. And then some people that say all the time. So yeah, that's quite an interesting article.
Yeah. So, the issue, is that this paper was done with healthy dogs. And so we still have no information about how the flotation vest affects dogs that have hip dysplasia or post-op cruciate tears, or the neurologic patient, the dog that's a post-op hemilaminectomy. And so those recommendations might be entirely different based on their underlying pathology and their disease process. And so that's where, we really need more research. We need to kind of fill in those blanks to be able to make, recommendations. This patient should get, a flotation vest. This patient doesn't necessarily need it. Maybe it's better without it for this patient. And we just don't have that data.
Is that a limitation that we have with a lot of the research in hydrotherapy?
That's a lot of the limitation that we have with research in rehab and sports medicine in general. It's definitely, a newer growing specialty, and we have a lot of lack of research just kind of across the board. But hydrotherapy, yes.
All right. So that was the one swimming. Do you have any other swimming research that you wanted to chat to us about?
Yeah. So I guess the other, interesting one was a paper done by Fish, where they actually looked at kind of the swimming gait pattern, kind of that, what we call the dog paddle. And it was actually a pretty well done study. And it was, I'm not sure it's necessarily that clinically important as much as it kind of supports what we already kind of assume based on kind of that gait cycle in the water. And so essentially there's no variation by breed, which is actually kind of interesting because obviously on land we know that there's significant variance in gait by breed, but in the water that seems to kind of equalize. And, we kind of know that dogs have that power phase and that recovery phase. And so maybe not so much clinically relevant as it is just kind of nerdy interesting. And then there are some, newer studies on like joint angles and neck angulation, but I'm not sure a whole lot of those change what we're currently doing. And then there was the one study on hydrotherapy in elbow range of motion in dogs with elbow dysplasia that basically showed that hydrotherapy improved elbow range of motion in healthy dogs and in dogs with elbow dysplasia, but more in dogs with elbow dysplasia, which we kind of, assumed, but it's nice to see that supported by the research.
Yeah, that one about the breeds I found quite interesting. So, how many different breeds did they test?
Ooh, that is a good question. And I do not know that off the top of my head. I know that they had some large dogs. It said they had 6 different breeds, but I don't know off the top of my head what those 6 different breeds were. I know they had some really large dogs and some really small dogs. So there was a pretty good variation.
Yeah, because there is another podcast that I've done, I think with Angela Griffiths, and she does hydrotherapy at Greyfriars Hydrotherapy, and they have actually a course there, the Greyfriars course. And
right.
I think we had a conversation about the breeds, nothing scientific. So this is just basically anecdotal stuff that she'd noticed. And there definitely was some that she'd noticed some changes in the way that some of the breeds swim, and how where their center of gravity is, depending on the size of head that they have. And I'm trying to recall now from that previous one, and I can't remember off the top of my head the podcast number, but yeah, it was really, really interesting what she was saying. So yeah, I'd love to have a look at that, the types of breeds that were there, see whether, if it's some sort of basic type breeds, or like, as soon as you get into things like.
I just pulled it up. So it's 1 German Shepherd, 2 Labrador Retrievers, 2 Newfoundlands, 1 Nova Scotia Duck Tolling Retriever, 1 Parson Russell Terrier, and 1 Yorkshire Terrier.
Okay.
So yeah, large and small. Some dogs that are obviously more, supposedly natural swimmers versus like a Yorkie, which I wouldn't think would be a natural swimmer.
Yeah. Okay, that's interesting. So I suppose it was quite a small sample size. So maybe if you were specifically looking at like the effects of breeds on the way that they swim and their center of gravity, because that for me I think is the main thing.
And this specifically looked at the actual. It didn't look at this like the center of gravity as much as it looked at the actual limb dynamics. So like how the legs and paws move, so kind of that rotation and that kind of gait cycle as opposed to that center of gravity. And they did have a lot of variation in swimming velocity, which would make sense based on the size of the dog.
Yeah, and I suppose it's the dog's legs would move no matter what, and it's really just the center of gravity just can affect the position, so where they are, right?
And the body size did change the stroke frequency. So that's probably kind of the biggest thing that people are going to notice, when they're swimming the dog, is like how much they're actually paddling. But yeah, the actual way that the limbs move is pretty similar.
Okay, great. So that was the swimming. So anything in the underwater treadmill, which we would find interesting?
Yeah, so there've been some recent studies on like looking at actual muscle fiber activation, because obviously we use underwater treadmill to try to help build up muscle, and it's pretty unknown how the water treadmill actually affects muscle activation, which then would affect how you actually build up muscle mass. And so there was a pretty recent study that was done by Vitger on the impact of water depth and speed on muscle fiber activation. And once again, it's in healthy dogs, but they looked at 2 different water velocities and 4 different water depths. And they actually used kind of acoustic myography sensors. And they only looked at the bicep femoris and the vastus lateralis muscles, but they found that more muscle activation was required to walk in the depth at the level of the mid femur compared to shallower water. But obviously that's just looking at those 2 muscles, because obviously those muscles, have to kind of overcome the resistance of the water. And, so there are differences. There are going to be differences in kind of the muscle groups, whether they're a flexor or they're an extensor or things like that. And so this only looked at those 2 muscles. So obviously, that'll vary based on which muscles you're looking at and which ones you're targeting. And so then there was another one that was done a few years ago that used surface electromyography and looked at the glute medius and then the longissimus dorsi. And so we're starting to get a little bit more research on, kind of looking at specific muscle groups, but there's still kind of that big gap. We have some information about a couple of the muscle groups, but we haven't looked at all of them.
So what would be interesting is to look at the difference between those 2 muscles and the difference in swimming and an underwater treadmill. So much research, that we want to know.
Yeah, I mean, we really have no studies that compare side-by-side hydrotherapy and swimming. We have hydrotherapy papers, or we have swimming papers, and we have underwater treadmill papers, and there aren't any that use the same group of dogs and look at any of the factors, side by side for swimming and underwater treadmill. And so that would be a whole nother set of studies that would be really awesome to have.
Yeah, because it's always a question, right? I mean, if I think about practices that have got an underwater treadmill compared to practices that have got a swimming pool, they're all questioning, which cases should be going in which, and all of them are trying to justify why swimming is better for whatever particular case. So if I think about, in our groups, in our Facebook groups, the conversations that are happening, there's always these questions, and somebody would suggest, well, you should do this hydrotherapy or swimming in this case. And then somebody will say, no, but underwater treadmill does this and this. And it's sort of like a little bit of if you've got both, then it doesn't matter. But if you've only got one, then it's like these 2 sort of sides that are against each other and trying to prove why whether it's underwater treadmill or swimming is better than the other one.
Right. And we really just don't have that much research. I mean, I would say there's probably more research for like the stifle in both cases of underwater treadmill and swimming to be able to make a little bit more of a comparison. But once again, like none of those studies were side by side. So there were, cruciate, swimming studies and cruciate underwater treadmill studies, but, or actually there weren't cruciate swimming studies. There were stifle like kinematic studies, but cruciate underwater treadmill studies, but nothing that compares it side by side. So we have to I think we can make a little bit more conclusions about the stifle versus anything else, but we still don't have the best studies to be able to 100% say like, this is what we need to be doing.
Okay, great. So I think you had 1 or 2 more studies in the underwater treadmill that you wanted to discuss.
Let me see. I think the muscle activation was the biggest one, and that there were the 2 there. And then, talking about cruciates, there was a more recent study, I mean, as of like 2018, looking at the pelvic limb kinematics in cruciate dogs that had surgery. And so, that one, once again, just like all of our veterinary studies, like one of the biggest limitations is sample size. And those dogs had an extracapsular repair. So, not a TPLO, which is kind of most often standard of care these days, but they looked at kind of 4 water heights for these post-op cruciates. And, kind of the big take homes was that using a water level at the stifle or hip is going to maximize that stifle range of motion, which may help to kind of counteract that decreased range of motion that we get from the cruciate tears and the post-op kind of cases. And kind of the, secondary conclusion was that the underwater treadmill therapy may be more effective in returning stifle extension specifically than swimming, just based on the kinematics of the underwater treadmill versus swimming. And so I think, just like we were just talking about, I think of all of the kind of pathologies and research that we have in hydrotherapy, the stifle, we have a little bit more to be able to say underwater treadmill is probably better at returning range of motion than swimming is, but literally just the stifle.
Yeah, I mean, if I think about even when I studied the CCRP, I think that was the main research that was in hydrotherapy, was all about stifle, loads of things about the stifle. I mean, this is one of the things that, we were chatting earlier about there not being a hydrotherapy textbook, and I think one of the things that you mentioned was, well, maybe we don't have enough research. So we just need more research, right? That's one of our things for our profession is we need more research and more researchers.
Yeah. And more research funding and more people willing to participate in research, because sometimes like recruitment is really hard for studies. And I mean, I think that's probably the case across the board, for veterinary medicine in general, but for sure our specialty, since, it is newer. I mean, you look at, the veterinary surgery literature, and it is quite vast. And, with all of the residency programs, I mean, one of the other things too that plays into it is, for all residencies, you have to do research and publish at least one paper, depending on the residency. And so if you look at a field like surgery or internal medicine, where there's so many residents that have to publish papers, you're going to get a much larger quantity of research every year than for our area, where, we've got some researchers across the world who are doing studies, and we've got some residents, but not nearly the number as we have for surgery or internal medicine or neurology or any of those other specialties.
Yeah, and I mean, you're doing your board exams at the moment. So, I mean, you basically have to go through all the research, right? So you have a really good idea about how much research we have, because pretty much every article you need to know for your exams.
So, yes, apparently.
Wow. Yeah, and I mean, we were chatting about that textbook. I mean, there are some small chapters in some of the rehab books. And I remember that was one of the things that I felt probably the most overwhelmed with when I went into practice. I was a vet and doing normal practice, and I went into the CCRP, and then, opened my rehab practice and, got my loan for my underwater treadmill. And then I was like, oh, wow, now I have to do underwater treadmill. And I must say, I felt pretty like unprepared for it. And I had some serious imposter syndrome on the underwater treadmill. I thought, and I remember just looking for information on it, and there wasn't a lot. This is now like 2005, 2006, and it's one of those areas. I mean, luckily now we have a whole lot more people that are doing courses, and in the UK, hydrotherapy is actually a profession on its own. You can actually hire hydrotherapists, and they've got loads of courses there. Not so much in the States though, right? You don't have hydrotherapists. You've got vet rehab therapists who do hydrotherapy.
Correct.
Yeah. So, I mean, it's a growing field, but there's still a lot that needs to be done. And a lot that needs to, all that research is eventually going to help obviously prepare us vet rehab therapists when we eventually have to open. And I think a lot of the things that we do, I can definitely say for myself, was experimental. I would just try things and see, does this work? Does this help this dog? So very much just doing my own little research at my clinic and working out what worked for specific cases.
Right. And I mean, I think in our field, experience and trial and error does play a pretty large role, because we lack a lot of the data to be able to say that, one way is better than another. And I think that that's, entirely valuable. And, I think that plays into our research. We use that experience to be able to kind of create these research projects, because we could say, okay, well, we've seen this in the clinic, so like we should study it. Like we should actually take these cases and look at it in more detail. I mean, that's how research projects come along.
Yeah, I mean, what is your feeling, behind when people say, well, there's no evidence behind that, especially in our fields, often you'll have conversations with people, and then somebody will recommend something, and the quick reaction is, well, where's the evidence to support that?
So we have to look at everything critically. And in our field, it is harder because in a lot of the cases, we don't have any evidence for what we're doing. And so I think that in those cases, experience and kind of anecdotal reports or case report, we have to take those into account until we have better research and better knowledge. And so we can't throw, people's 20 years of experience out the window because it's not actually published research. But at the same time, some people will claim, oh, well, this is supported by research when it's really not. And so we have to look at everything through that critical lens, but not throw out experience and not overstate the research that we have either, because just because there is something written in the research doesn't mean it's black and white. I mean, there are limitations with research and with publication. And so, I think we have to balance that when we look at our practice, like, what does the research show? Do we have the research? How is the research done? If we don't have any research, then we have to take, people's experience into account. And I mean, I think that's where our, the online pet health is great. And the Facebook group is great because, it kind of going completely off the hydrotherapy topic, but the Cushing's myopathy talk in the, that we had in the group was great, because there were literally 2 case reports in the entire, publication. But a lot of the researcher or a lot of the, group members had experience with, a few cases here or there. And that knowledge combined is super valuable, even though it isn't published.
Yeah. And the thing is that if we are not sort of thinking outside the box and we're not trying new things, then like, where do our ideas for research come? Because that's how it happens. You
Right.
think of something and then clinically you think, well, that makes sense. And you try it and then you're like, well, this seems to be working. And then you voice it to your peers and they say, oh, wow. Or somebody says, I've actually done that and I agree. Or somebody says, I'm going to try that. Then they try it and they say, well, actually, I think you might be onto something. And then you're like, okay, well, maybe we should do some research on this topic. And so, yeah, I'd like to just encourage the vet rehabbers out there not to shut down your peers and your colleagues when they have a new idea or when they say something right away. Don't say, well, where's the research to support it? Because these are where the ideas come for the research. So yeah, we got to encourage all these people that are stepping outside the box, right? And like saying, well, let me try this. As long as, they are doing it, like you say, with a strict, what did you say, clinical lens, so that they know that they can, with their own clinical reasoning, they can work out that they're not doing any harm, so what they're doing actually potentially could be helping.
Right. Yeah. As long as, do no harm. And, obviously, there are things in the literature that, are contraindicated, but, as long as you're taking kind of the whole patient into account, I think, trying new things is the way we progress forward and the way we get research.
Arielle, if there was somebody out there who was interested in getting involved in research, what would the suggestion to them be?
Oh gosh, definitely find yourself a mentor who has a history of research and publication, because I think that that's where a lot of people get stuck. They have an idea, but then they don't know how to actually move forward with that idea. And, there are a lot of kind of intricacies with making appropriate study design and with, making sure your, statistics are correct. There's also through the Canine Rehab Institute, there's the clinical research course that's taught by Dr. Chris Zink. And so, just kind of having some background knowledge on how to do research in a clinical setting is definitely helpful. I keep talking to my friend who's a statistician who helps me with this, statistics on my projects about kind of creating a, more comprehensive kind of series of courses on doing research in veterinary medicine, and specifically in sports medicine and rehab, just because I think that there are a lot of people in clinical practice who would be super valuable on getting research done and getting research out there because they have access to the cases. And it just doesn't happen because people just don't know how, or they get stuck somewhere in the process and they have nobody to help them.
Yeah. And I think it's also a little bit overwhelming. When I think about it, I just think, like you talk about all the statistics and, setting it up correctly. And I think there's such a fear that you do the whole thing and then somebody comes and says, but this, and then you realize, oh, you've made this massive error. And now it's not significant anymore. So yeah, there's a lot of, for me, like if I think about if I had to get involved, there's a lot of fear and just a lot of overwhelm around it. But yeah, that CRI course, I've had a look at that. That looks really, really great. And that's the thing, is that you got to like everything, right? You need to get your knowledge up there. So you have to study on how to do it. Right. You can't just wing it, or you need someone to support you.
Yeah. I think having mentors is super helpful. And I mean, I think that, the nice thing about our field is that, we're all pretty friendly and supportive. And I think that, if people have interest, there are plenty of people, they can reach out to help get them started kind of on their research projects. It's definitely, one of my passions. And I'd love to be able to maybe eventually start some sort of company group type network that is specifically targeting, research in the field to be able to support, researchers. So being able to help with funding, help with study design, and, once the studies are done, help with kind of analyzing the data and the statistics and the writing and everything. I would love to have something for our field that supports that, because unlike say surgery, the number of veterinary rehabbers that are in clinical practice versus academia is huge. And so most of the research comes out of academia because the academics have allotted time to do research. They have the experience. Their colleagues can help with mentorship. The funding is easier when you're associated with an academic institution, but there aren't a lot of rehabbers who are in academia. Most people are out in clinical practice. And so I think having a way of supporting clinical researchers is super important for our field specifically, compared to, the other fields that have a huge number of people in that academic setting.
Yeah, I love that idea. And because they're in clinical practice, also their time is so limited, right? Mm-hmm. So they, in academia, you get time allocated to do your research, whereas in private practice, you're just doing that when you have a little bit of spare time, or you take a few days off. So what are the questions that you'd like to see answered in future research in hydrotherapy?
I think that kind of the number one priority would be to look at swimming and underwater treadmill in the treatment protocols for different pathologies. So looking specifically at things like elbow dysplasia, hip dysplasia, post-op cruciates, post-op hemilaminectomies, the neurologic cases, and actually, being able to compare swimming versus underwater treadmill. How do they work? How much benefit? What's the best protocol? So we're not just making things up as we go. I think that would be our number one priority, because that's primarily how we're using these modalities. And then I think kind of another one that we should look at is how to use these modalities for fitness, so conditioning, because people use it all the time for, athletes. We put them in the underwater treadmill to try to help build up, strength and fitness for whatever sport or, working dogs, conditioning. does it actually help? Like we don't know. There are no studies looking at it in that kind of fitness realm, but we do it all the time. So having data on that would be super helpful as well.
Do you know of any studies in humans around strengthening and conditioning, and because they use underwater treadmills too, but I think it's mainly for rehabilitation?
Yeah, I actually don't. I have not. I mean, I know that they have the underwater treadmills, but I have not looked into the research on the human side, what they've actually done research for.
Yeah, it might be interesting.
That's a good rabbit hole for me to go down, and then I'll let you know.
Yeah, let me know. Awesome. It's been so wonderful chatting to you, and I love your passion and enthusiasm for research. So yeah, that's why I've given you the name of the Queen of Research. So yeah, thank you for sharing with us and taking the time to share all your research with us. And yeah, we're looking forward to hearing about what happens in humans with conditioning and underwater treadmill and how we can extrapolate that into rehab.
Yeah, and if anybody on like the Facebook group ever has any research questions, I'm always happy to go down rabbit holes and pull papers and post them. And so that's one of the things I actually kind of my nerdy self really enjoys doing. So I'm always a volunteer to help, dig up research if anybody has questions.
Awesome. So you know what to do, guys. Just tag Arielle in. Thanks so much for your time. Have a great day, Arielle.
Yeah, thanks for having me on. Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. And please, if you get a moment, head over to Stitcher or iTunes and leave me a review. It's a really lonely job being a podcaster, and so the only time I get to hear from you or know that you're out there is when I get a review. And know that I read every single one of your reviews. So to those of you that have left reviews, I want to say a very, very big thank you. Every time we get a review, it really helps to get the Veterinary Rehabilitation Podcast out there to all the vet rehabbers all over the world. All right, vet rehabbers, so if you are looking for more continuing education in the field of veterinary rehabilitation, head over to Onlinepethealth.com. Go be awesome, guys.